Now the second part, that is pubis bone. Pubis, it is one of the ventral component of a hip bone. It forms the antero-inferior part of a hip bone and anterior 1/5 of a acetabulum. The anterior border of a obturator foramen, it formed by the pubis bone. The external features of pubis bone, it has a body. This is the body of a pubis bone. It placed anteriorly. This is the superior ramus of a pubis bone. It is lies suprolaterally, and this is the inferior ramus of a pubis bone. It is lies infralaterally. We discuss each feature and its attachment individually. So first we discuss the body of a pubis bone. The body of a pubis bone, it has features like pubic crest, pubic tubercle, 3 surfaces. So what is pubic crest? The pubic crest, it is nothing but the superior border of a body of a pubis bone. This is the medial surface of a body of a pubis bone, and this is the upper end of a medial surface. So from this upper end of a medial surface, if we go 1 centimeter lateral, we will find a one tubercle. So this tubercle known as pubic tubercle, and the linear elevation from the upper end medial surface to the pubic tubercle. So this linear elevation known as pubic crest or superior border of a body of a pubis bone. Now 3 surfaces: anterior surface, posterior surface, and medial surface. The anterior surface of a body of a pubis, this is anterior surface of a body of a pubis, it goes downward, forward, and slightly lateral. The posterior surface, it is also known as pelvic surface. It is smooth and it directed upward and backward, and it forms the anterior wall of the true pelvis. This is the medial surface of a body of a pubis. It is also known as symphyseal surface. This symphyseal surface articulate with the symphyseal surface of the body of a opposite pubis, and it forming the pubic symphysis. So these are the surfaces. Now attachment on this body of a pubis. So if we enlarge this much portion, so this is upper end of the medial surface, this is pubic crest, and this is pubic tubercle. So attachment on this pubic tubercle. So this pubic tubercle gives attachment to the medial end of the inguinal ligament, along with the ascending loops of cremasteric muscle. So this pubic tubercle gives attachment to the medial end of the inguinal ligament and the cremaster muscle. In males, the spermatic cord, it passes from the tubercle. So these are the attachment and relation of pubic tubercle. Now attachment on the pubic crest. So we divide the pubic crest into 2 halves. This is the medial half of the pubic crest, and this is the lateral half towards the pubic tubercle. This is the lateral half of the medial pubic crest. So this medial half, this portion, it is crossed by the medial head of the rectus abdominis muscle. The lateral half of pubic crest, this part gives attachment to the lateral head of the rectus abdominis muscle along with the pyramidalis muscle. So this pubic crest medial half crossed by the medial head of rectus abdominis muscle, and the lateral half gives origin to lateral head of rectus abdominis muscle along with the pyramidalis muscle. So these are the attachment on the body. Now the posterior surface. The posterior surface or the pelvic surface, it provides attachment to the one muscle, that is levator ani muscle, its anterior fibers. So the anterior fibers of levator ani muscle will arises from the middle part of the posterior surface or the pelvic surface of a body of a pubis bone. It also gives origin to the obturator internus muscle. So this whole area gives origin to the obturator internus muscle. One ligament, pubovesical ligament or puboprostatic ligament. So this ligament attach in front of the attachment of levator ani. So this area gives attachment to the pubovesical ligament. So these are the attachment on the posterior surface of a body of a pubis. Now we discuss the second feature of a pubis, that is superior ramus. So this superior ramus, it extends from the pubis to acetabulum. This superior ramus has 3 borders and 3 surfaces. So first we discuss about the 3 borders. It has superior border, anterior border and the inferior border. So first take a superior border. The superior border, it is also known as pectinate line or pectin pubis. This superior border, it is very sharp. So this is the superior border of a superior ramus, pectinate line or pectin pubis. It is very sharp and it extends from the just behind the pubic tubercle, extend up to the posterior part of the iliopubic eminence. So this superior border along with the pubic crest, it forms the pubic part of arcuate line. So the pubic part of arcuate line, it is formed by the pubic crest along with the superior border of a superior ramus. Now anterior border. The anterior border, it is also known as obturator crest. This anterior border, it is rounded and it extends from the pubic tubercle to the acetabular notch. So this is the anterior border. This is acetabular notch. Third border, this is inferior border. This inferior border is sharp and it forms the upper margin of the obturator foramen. So this is inferior border. This is obturator foramen. So this is inferior border of superior ramus. It forms the upper margin of the obturator foramen. Now attachment on the borders of superior ramus. So first we take a superior border or pectinate line or pectin pubis. So this superior border of superior ramus from medial to lateral, it gives attachment to the various structures. So first the medial most structure, that is conjoint tendon. So the medial end of pectinate line or superior border of superior ramus, it gives attachment to the conjoint tendon. On the medial end in front of this conjoint tendon, it gives attachment to the lacunar ligament. So this area in front of the attachment of conjoint tendon, medial end of superior ramus gives attachment to the lacunar ligament. Now attachment lateral to this lacunar ligament. So this whole area of a superior border, it gives attachment to the pectinate ligament of Cooper. So this whole area gives attachment to the pectinate ligament of Cooper. The pectineus muscle along with its fascia arises from the whole length of pectinate line. So this whole length of pectinate line, it gives origin to the pectineus muscle along with the attachment of fascia covering the pectineus muscle. One muscle, that is psoas minor muscle, sometimes it is present and sometimes it is absent. If this psoas minor muscle is present, then it inserted on the superior border or pectinate line of a superior ramus. So these are the attachment of various structure on the pectinate line of superior ramus. Now we discuss the 3 surfaces of superior ramus. So first, this is pectineus surface. This pectineus surface, this is the pectineus surface. It is a triangular area. This pectineus surface lies in between the anterior border and the superior border. This is the superior border and this is the anterior border. So in between these two borders, this is the triangular pectineal surface, and this pectineal surface gives origin to the pectineus muscle. Another surface, this is pelvic surface. This pelvic surface lies in between the superior border. This is superior border and this is the inferior border. So this is the pelvic surface or the posterior surface of superior ramus. Third surface, this is obturator surface. This obturator surface lies in between the anterior border. This is the anterior rounded border and this is the inferior border. So this is the obturator surface of this superior ramus, and this is obturator groove. The content passes through this obturator groove, obturator nerves and vessels. Now third feature of pubis bone, this is inferior ramus. So this inferior ramus extends from the body of a pubis. This is body of a pubis. So it extends from the body of a pubis to the ramus of ischium. This is ischium bone. So this is the ramus of ischium. So from inferior ramus of pubis is extend from the body of a pubis to the inferior ramus of the ischium bone. This inferior ramus lies medial to the obturator foramen. This inferior ramus of a pubis bone, it fuses with the ramus of ischium bone and it forming the conjoined ischiopubic rami. So this is ischiopubic rami. So this is all about the pubis.